Happy February 4th, everyone. Dr. John Asplund here. Today I am masked up because I'm with a group of students and staff. I'm here today at the Career and Technical Education Center, GAVC, to celebrate Vocational Month, Career and Technical Education Month. And you hear a lot from me every week, so this week I figured I'd just turn it over to Mr. Houston, who will then introduce our special guest.
Yeah, thank you, Dr. Asplund. Yeah, today we're we're actually celebrating Career Technical Education Month, where we are trying to get awareness around all the opportunities that we have in our vocational center and through our high school and area high schools. And in that celebration, we're trying to recognize those high wage, high demand, high skilled areas of work in this region. And you can tune in on Monday mornings for this month and hear some of the guest speakers that will be on WGIL. We'll be talking about some of these things, but as Dr. Asplund said, instead of hearing it from me, we've got Nurse Lori Larson here, who's in charge of our health occupations program. She's going to tell you a little bit about what goes on in career technical education in her program.
Thank you. So I teach the health occupations class. It is a certification class to become a certified nursing assistant. So when the students have completed the required hours for IDPH, 80 hours of theory, 40 hours of clinical, they are eligible to sit on the state board exam to become a certified nursing assistant. Very well-paying job currently right now. It's a high demand, as we all know, with what has been going on in our country, throughout the world with the pandemic, and very high demand job. So they do very good work. So we learn lots of things, such as making beds, how to help people dress, how to help people brush their teeth, get a bath, give a shower. And one of the first things that we learn is how to properly wash our hands and how to properly put on PPE, which has been very popular. So I have some of my students here who have correctly demonstrated, it looks like, missing your goggles, but that's okay. Correctly have demonstrated how to put on their gowns. So let's show them how we properly, why don't you come on out, and properly show them how we are going to take off our gloves. You just don't take your gloves off any old way. So let's see if they remember from last week, or earlier this week when we were here. So yep, you're gonna grab it, put it up in a nice ball there. Perfect. So excellent, and then you're going to throw it in the trash behind you. Excellent. How about we demonstrate then how to properly take off the gown, see if we remember it. We haven't been in class since Tuesday, so we'll see if we remember it. We don't want to touch the outside of the gown because it is contaminated, so we've got to very carefully and trickily untie, touch it from the inside, pull it inside out. Don't let it touch the ground or your bodies. Excellent. Then you're going to roll it, turn it to the inside out. Don't let it touch your body there. Very good. And then roll it away from you and also toss that into the trash. How you doing back there? Looking good. Loraya, looking good. What are you going to do if it gets in a knot? Ask somebody to help you. So, excellent. Pull it inside out. Very good. Roll it up. Excellent. So they have properly doffed. Doffing means to take it off. So they donned, and now they have properly doffed their PPE. So just one example of the many things that we do here in the health occupations class. So thank you for letting us share.
Well, this is a wonderful lesson that we learned today on PPE and how to take off gloves and how to take off our gowns. And this is just a couple of the many skills that our students learn here at Galesburg Area Vocational Center. And happy to be here today with our students. So signing off for only the third day of the week because of snow days this week, and hopefully next week we'll have better weather. But signing off for today, Dr. John Asplund.